This is Michelle. She's a single mom of 2 kids, ages 7 and 2. She recently split up from her partner, who was the main breadwinner. She now works 2 jobs, just above minimum wage, and her average take-home pay each month is $1,600. Rent for her 2-bedroom apartment is $1,000. She pays $400 in childcare each month, and that leaves her with $200 to cover food, gas, utilities, and other essential expenses. She tries to save money, but unexpected expenses often come up, like last month when her 7-year-old boy got a bad case of the flu and school and daycare wouldn't take him. She had to miss a week of work without pay, missing out on $400 in wages. She does the math, and after paying for her kid's doctor bill, food, utilities, and gas, she's now $200 short on making her rent. She pays what she can, but her landlord isn't willing to give her more time and puts an eviction notice on her door. Michelle is terrified. In my work, I meet people like Michelle every day. The good news is we can prevent Michelle's eviction and potential fall into homelessness from happening to her. And we should. Housing is a basic human need. Without a safe and stable home and a place to sleep, shower, prepare food, do laundry, and gather with loved ones, it's nearly impossible to do anything else. I've seen this in my work in our community supporting tenants at risk of eviction, from working with indigenous communities in Asia and Africa at risk of losing their lands to agro-industry, to working with people in the Bay Area who had been living outside for decades. I've seen this fact again and again across all kinds of different people and communities. Without housing, it's impossible to think about anything else. Housing is everything. Unfortunately, there are so many people around the world right now that are housing insecure or living without housing. This has only been amplified by the COVID-19 pandemic. In the US, the cost of housing has continued to increase at an unprecedented pace while urban centers experience population growth and struggle to keep pace with housing needs. At the same time, the cost of other essential expenses such as childcare, healthcare, and education have also continued to increase. And wages aren't keeping pace. As a result, the gap between income and basic essential expenses continues to grow. People aren't able to save money, let alone save up for a down payment, which decreases their ability to control the cost of housing year to year. The reality is, the United States is in the middle of what many are calling the Great Affordability Crisis. It's why 2 out of 5 Americans can't come up with $400 in an emergency, why 3 out of 5 can barely pay their monthly bills. It's why any unanticipated expense or shortfall like a doctor bill, traffic ticket, or job loss can easily lead to an eviction and potentially homelessness. Can you imagine what you would do if your kid got sick and you had to choose between getting needed care for your child and paying your rent? This is the kind of choice many people, like Michelle, are having to make every day. It's the main driver behind increasing rates of eviction and homelessness around the United States. There is now 1 eviction filing for every 17 renting households, and 1 legal eviction for every 40 renting households. The majority of these evictions are happening because people can't pay their rent. Alongside the increased cost of housing and eviction numbers, the rates of homelessness around the country are also increasing. This isn't a coincidence. Eviction and homelessness are a housing affordability problem at the root. People want to have a home, they just can't afford it. In our community, a large majority of people requesting rental assistance, around 80%, are unable to pay their rent because of job loss, while the rest have experienced some other unanticipated expense or shortfall. National data confirms that eviction and homelessness are a housing affordability problem at the root. Virtually anyone could be susceptible to eviction and homelessness given the right set of circumstances. And the impacts of housing loss are huge. Research has shown that housing insecurity of any kind causes physical, social, and mental health impacts that last a lifetime, especially for children. A record of eviction and homelessness operates similar to a criminal record, precluding people from housing and employment opportunities for decades. Tenants apply to dozens of rentals, pay hundreds of dollars in application fees, and may not get a single response back. In a high-demand rental market with a low vacancy rate, affordable housing is even harder to find. Housing loss is also expensive for a family. It costs around $5,000 on average for a family to find new housing after they've lost their home. It costs the community as well. In our community, it costs around $50,000 per person per year who's homeless, taxing our healthcare system, first responders, and nonprofit organizations. Thankfully, there are solutions that work to prevent housing loss from happening to our neighbors and to our community. We know what works to prevent eviction and homelessness: financial assistance and supportive services. We have invested in these interventions in our community, and it's proven to be successful so far. Those interventions have been shown to reduce housing loss by over 90% in our community and nationally. And they're cost-effective. Compared to responding to housing loss after it's already happened to a family, around $5,000, it costs our community $1,000 to keep a family in their home. So we know what works, but because we're in a housing crisis, demand for our resources is high. We can't possibly keep up. This has only been exacerbated by the COVID-19 pandemic, where the cost of housing continues to increase while many remain without work. Requests for rental assistance in our community went up 300% during the pandemic. So the next question is, how do we decide who gets what resources? Most of us like the idea of being able to help everyone who walks through our door, operating on a first-come, first-served basis. But because we're in a crisis, if we did that, we'd run out of resources in a day. So we've come up with a system to care for our most vulnerable neighbors, those at highest risk of eviction and homelessness, first. To do this, we use a research-based assessment tool and algorithm to decide the level of support people receive, modeled after the way homeless resources are administered around the U.S. We ask tenants a series of questions based on their vulnerabilities and history of housing insecurity and financial insecurity, then run their answers through an algorithm to assess their level of need. That way, we can tailor their level of support to meet each individual where they are. The approach can be likened to an emergency room in a hospital. If 3 people walk into a hospital, one with a serious head injury, one with a broken bone, and one with the flu, hospital staff will assist each person while also effectively and efficiently using their limited resources. In the hospital, a person with a flu will receive over-the-counter medicine and a referral to urgent care. When my staff sees someone with lower needs, maybe someone with a strong employment and housing history and a good relationship with their landlord, they can be provided with information and tools to set up a payment plan with their landlord. In the hospital, the person with a broken bone will be sent to a nurse to get an x-ray done. When we see someone in the middle range of risk who's being evicted, maybe someone with a bad relationship with their landlord and poor budgeting skills, but the ability to pay rent going forward, they can be provided with supportive services, including landlord mediation and assistance setting up a budget and payment plan that works for them. In the emergency room, the person with a serious head injury will go to the doctor. When we see someone with a history of eviction and homelessness or someone going to eviction court, we treat those cases as more urgent. They're provided with financial assistance to catch them up on the rent that they owe, as well as intensive supportive services, including landlord mediation, employment and budgeting support, and connections to community resources. Some folks may need more financial assistance, including back rent, a security deposit, or a couple months of rent going forward. So far, initial results of our approach are looking promising. But because we're in a crisis, it's important that we continue to triage, like our hospitals, to allocate what we have to people who need it the most. We may not have the immediate power to raise wages and solve for our affordable housing crisis across the country today. but we can deploy what we have to people who need it the most, to our most vulnerable neighbors. And this is something we as a community can do right now. And you, as an individual, can always help too. Keep your eyes and ears open to your neighbors, friends, relatives, and coworkers. Financial insecurity is oftentimes invisible, and you could be that linchpin for someone during their greatest time of need. Get connected to nonprofit organizations on the front lines of the housing crisis by donating or volunteering. Get involved in local government, including neighborhood associations and city and state government, to advocate for the growth and availability of affordable housing and housing supports. Consider creative ways you can grow our affordable housing stock by opening up a spare bedroom in your home or building a tiny home in your backyard to lease to a long-term renter at an affordable rate. Eviction and homelessness really could happen to anyone right now. Maybe all our neighbors need is a hand up during a critical point in their lives. If that means more of our neighbors, like Michelle, can stay in their home, and we've done it at a lower social and financial cost, that's a big win for her and for our community. Thank you.